thank you all for coming. We don't know where Dr. Mayer is at the moment, but we've got Dr. Enam Hack here for us, and also Anissa Jafar, who's just had a baby, so she's done a video recording of her talk for us, which we'll play to you as well. So yeah, thank you for coming, and we'll just get started.
I was just saying to the group, this is brilliant, this is a massive attendance. I'll exaggerate on Twitter that a few hundred people came. I'll just put you all concentrated together and things like that. So my name's Enam Hack. I think I've met a lot of you guys before, have I? Yeah, hi. So you remember me from those halcyon days of early clinical experience in the Consultation Skills Centre, where everyone is happy and the world is happy and the sun is shining if the sun could get into the Consultation Skills Centre. I'm also a GP in Levenshulme in central Manchester. Does everyone know where Levenshulme is?
Yes.
Where is Levenshulme?
Stockport Road.
Stockport Road, where Nawab is. And there's also a good subway there. You get a really nice subway sandwich there. I'm feeling hungry now. So what am I talking about? I'm talking about languages in medicine. This is an area that I'm really passionate about, okay? And the reason I'm passionate about it is because I see it in my everyday life, both as a person and then as a doctor and then as an educator. So what I'm going to talk about is the importance of diversity in languages. Mind Your Language, which is a very cheesy title. If I'd said this to you guys 15 years ago, you would have cracked up laughing. Because you've never heard of Mind Your Language, have you? Okay, what I want you to do as homework today is to go to YouTube, put in Mind Your Language, and watch one of the most un-PC programs ever created. It's got people with strong Indian accents, people with strong Jamaican accents. It is so bad. So I just went and put an un-PC title for one of my projects, Mind Your Language. I will tell you what it is about. And then finally, speaking Bengali to my patients and the challenges with that as well. Oh, you're okay? Hi. You're following me? Ever I look, this guy is there. What's your name again? I'm only kidding, we know each other. Your name is Zahid, isn't it? Yeah, Zahid, you're keeping okay, yeah? Thank you. I like to engage the audience as well, so if I recognize faces, I just randomly talk to you. I apologize for that. Okay, so why is diversity important? Now, this is really interesting. Currently, we have about 13% of the population that is from a BME population. That's a black and minority ethnic minority group. The projection is by 2056 it'll be 44%. So those of you who support UKIP, I've got some statistics to tweet tonight. So it is going to become a major issue as time progresses. This country, I love it because of the diversity. I love the diversity. I love population. I love their food. Everything that is important about it. Why else is it important? Have you heard of the word cultural competence? Does anyone know what cultural competence means? Not to say that you're competent culturally. A bit more than that. Okay. No one's going to give a guess?
Just kind of being aware of different cultures and how to deal with them.
Brilliant, that's it. So go back to usual educational theory. You always look at the, yeah, I'll give you that as well. Knowledge, skills, and attitudes. Okay, so it's the knowledge of a particular ethnic group and having the skills and the appropriate attitude to make a difference, to break down barriers. Why is that important?
Well, to break down barriers, it's much easier to communicate.
Yeah, and it all comes down to communication, doesn't it? Because what do we want to do with our patients eventually? Treat them. Yes, treat them and to make them happy and cure the world, save the world. That's what we want to do as doctors, don't we? We want to save the world. Have you heard of the word cultural sensibility? Anyone hazard a guess on that one? To be sensible culturally? No. What?
Is that sort of, so we talk about cultural competence, which is awareness.
Yes.
Cultural sensibility then being sensitive, so being appropriate to other people's cultural beliefs.
Brilliant.
Values.
And how can you be culturally appropriate to somebody's belief?
Ask them what their values are.
Okay, if you look at it as a big group, how can you be culturally appropriate? Sorry?
I'm joking.
Okay.
I don't know. Probably, so if we're addressing a population.
Yeah. Anyone? I don't want to put you under pressure. It's like this is turning into like a Viva. I'll give you a certificate at the end of it. No more fist bumps though. So, we're there. Cultural sensibility is something I'm really passionate about. There's a lady called Professor Nisha Dogra. She is a professor of psychiatry. Has anyone heard of her? No one went, yay. No. Follow her on Twitter. She has like 10 people following her. Okay. She doesn't know how to use Twitter. She tweeted herself and didn't know what she was doing. She doesn't even follow me, and I think that's because she doesn't understand Twitter, not because she doesn't want to follow me. Thanks. Okay, so she has been the ultimate person in terms of diversity teaching in the world. Okay, and we're part of a national organisation called DIMA, Diversity in Medicine and Healthcare. So when you guys become doctors, you might want to join us. We're desperate. It's a great organisation, yeah, and I get to go to London, okay, which is okay. So what cultural sensibility means is you do not categorise people. So I'm going to say something really controversial. Is there any Bengali people here? Okay, that's all right then. I will be actually it's on video now, and I'm going to be hated by the Bangladesh society. Bengali people are famous for liking what? Fish. We are meant to be liking fish. Okay, this is the in-joke. Yeah, Bengalis love fish. I hate the stuff. Yeah, I absolutely detest it. No way. That's the worst. Don't ruin my evening. So I hate fish. Okay, so in terms of categorization of a population, you say, every Bangladeshi you see, when they come to your house, offer them fish delicacy. You offer it to me, I will hate you forever. So cultural sensibility means that you do not categorize people. You say that everyone's an individual. There's the fish-loving Bengalis and the fish-hating Bengalis. And you have to understand that when you approach a population. You can't just have a small talk with your next patient in the third year who says, I'm from Bangladesh. Oh, really? I love going fishing. What's your favourite fishing spot? What's your favourite type of salmon? Because they're just going to look at you and think, what a weird person. Okay. So, does everyone understand? Cultural competence, cultural sensibility. Okay, happy with that? So if there's nothing else you take away from today, these are big passions for me. There's so much study around these topics, and that is the crux of understanding populations. What did we do? Mind your language, okay? We got complaints. I used to have a job called a GP facilitator many years ago, which was to go to practices where there was complaints and concerns by students. And what I used to get in central Manchester all the time was students saying, this is horrible, this place. I don't understand a word of what's being said. I have no clue of what's happening here. And there were students actually going into practices where they spent the entire time just sat in a corner. And in those days, I don't think phones were as flash, so you couldn't really do much with your phone either. So I don't know how much of the yellow handbook that you can look through in that period of time. So it's a complete waste of time, you know. Especially if you had to go all the way to Oldham. Anyone on placement in Oldham? You know what Oldham's like, yeah? Yeah? How many bus rides is that? Uber taxi. All right, you're okay then. So unless you've got an Uber taxi, you know how painful it is. So if you went all the way to Oldham and you can't understand the language that's been spoken, what's the educational benefit? Brilliant. I'm glad you didn't say plenty. So what we did was we went to those, myself and Dr. Lindley. Anyone heard of Rachel Lindley? No. You should know who Rachel Lindley is. She's brilliant, okay? She's one of my bosses. That's why I'm saying that officially. She is amazing. Well, she is great, honestly. And myself and her, what we did was we created a workshop for GP tutors. So we taught them how to engage students in consultations in non-English languages. Okay? And from that, we worked out a protocol, and we started living off that. We started traveling to exotic places like Hull, Liverpool, and the best one, this is what will make you jealous, Kiel. Wow. Unbelievable places. In Kiel, I got stopped by the police. But anyway, that's another story. Let's not go there. We won't talk about that. But they're very friendly, the policemen, and I made them give me an escort because I was lost, that's why. Anyway, so we designed a tutorial for our tutors to be able to improve the experience. And I know I've only got 20 minutes, so what I'm going to do is I'm going to live a little. I'm going to go off track now, okay, if that's all right. I'm going to go off track, do something crazy. Okay, hands up if you speak a foreign language. Okay, now shout out what language you speak. Hands up if you speak Urdu. Okay, can I have 2 Urdu speakers? All right, suddenly. This guy's got memory lapse. It's all easier. You used to speak Urdu until I told you to come on down. Okay, that's fine. Is there any of those Urdu speakers that are happy to come on down? Because anyone who knows how I work, come on down. The price is right. And can I have somebody put their hand up who doesn't speak Urdu? Who wants to come on down? Okay, come on down. Yay. Right. Imagine the setting. This is Monday morning surgery in Levenshulme medical practice. Okay, so who wants to be the doctor? And who wants to be the patient? Now, apart from our man who's forgotten Urdu, no one else is going to understand this conversation, so you can say anything to each other, but you're going to do it as a consultation. Okay, what's your name? Sorry? Lorraine. Sanya.
Oh wait, am I? Oh, okay.
Sorry. We're not going to get too complicated. I don't do it hard. It's your real name. You can make up a name if you want. I can call you Stephanie or something like that if you want. Yeah, okay, but you can be your name. And your name? Khulud. Okay, so Khulud, you do not know any Urdu, because otherwise this experiment goes wrong. No. Okay, Khulud has come to a GP surgery. The GP and the patient are going to talk, okay? So if the patient, if you want to come through the door, who's the patient again? Me. Come through the door. We'll call that the door. These guys are too technical. I don't need this. Wow, okay, let's keep it simple. Okay, start talking to each other. Ignoring Khulud. Yeah. In Urdu. And what I want you guys to do is just think how you feel. Okay, I'll stop there. And now I'm getting cruel. I'm just making, well done. That's brilliant. Excellent. So, that's excellent. You didn't think you were going to come up to the front, did you? Anyone who knows me knows that I use the audience. Okay, so, Khulud? She's just next to me. I can't even say your name. And I'm teaching about diversity awareness. I can't even get your name right. I apologize for that, Khulud. So, Khulud, how did you feel?
Left out.
Anything else?
Confused.
Anything else?
Like a bit amazed.
A bit amazed that they could speak this language. I've known you for 3 years. I didn't know you could speak Urdu. Excellent. So Khulud is confused, left out. She's out of the loop. You guys watching, how did you feel? Same. Anything else? Sorry? Disengaged, yeah. Anything else? You didn't have an inkling of what is going on. They could be talking about the weather. They could be talking about you. And that's the thing with students. That's what they were saying. They said, we did not know what was going on. And what students were saying was, patients used to look at us as well. Can you imagine that? So try that. Talk to each other, but then start looking at Khulud and see what happens. Let's do a little here. Let's see what happens. Okay. Can't get the staff coming. Okay. Okay, we won't do that then. We need to get some proper mean people to do this kind of work, okay? But how would you have felt, Khulud, if they were looking at you?
Like they're talking about me?
They're talking about you, yes. And the suspicion, isn't there?
Yeah.
How does that help the doctor-patient relationship or the student-patient relationship? You don't trust them, do you? And they don't trust you back. So it's horrible, isn't it? That situation where you have that. Okay. Okay, so what we did was we showed them this video that was amazing. Proper professional actors. Luckily, I wasn't around, so it was actually done properly. And then we did a discussion amongst our group about how to change it. So let's live a little. Again, this is just coming to my head. I've got rid of my original presentation, by the way. And I'm doing something a bit different. I want to use this audience. You look like an intelligent audience. Are you an intelligent audience?
Yeah.
Oh, no, that's a delay. There's a delay there in terms of intelligent audience. So I was going to go off to the quiz night and get some recruits from there. So, we don't talk about the quiz night. Okay. Shout out what you would advise Khulud to do to improve the consultation, or advice to the GP. Who's the GP again? Lorraine is the GP. So what are you going to say to Lorraine to make it better, or what are you going to say to Khulud to make it better?
Maybe just after that consultation is finished, just say like, sorry, I'd really like to understand what's going on. Could you just come and give me a little bit of a debrief and try and include me a bit more because I really want to learn.
Okay, like so there's the afters. Okay, after the consultation, loads of opportunities there. Anything else?
Maybe the GP can summarise at several points during the consultation what's
brilliant. So summarisation. Oh, same thing. Summary. Brilliant. Well done. Anything else?
Maybe ask the GP to use a language that the student understands.
Okay. Brilliant. So you could encourage the patient to speak English.
Yeah.
That's good. Excellent. Have you guys been reading my protocol? It's like you're reading it word for word here. Anything else? I knew this was an intelligent group. Anything else? Was that it? I praised you that high, and your minds went blank. Anything else you would like? This is your opportunity. Imagine you're in Levenshulme medical practice. This is your one opportunity to influence change.
Maybe the GP could give her an opportunity to ask the patient questions.
Brilliant. So you turn to your patient, to your student, without looking suspicious and laughing at them in Urdu, but you actually ask them, is there any questions you want to ask? Anything else? Because now we're getting empowered. Khulud and Lareb are getting empowered now to make this the ultimate consultation. I can't really help you, you're just a patient. Anything else? Okay, shall we try that again? Forum theatre again? So, now you're empowered, Lareb. Now you're empowered, Khulud. Let's see this in action. So, patient, I've forgotten your name again? Sanya. Tanya. My wife's called Tanya, I better get that one right. This is Sanya. Okay, so Sanya, if you want to come on through, let's see a better consultation. Let's see it in action. You're going to be trying to make it better now.
Oh, okay. Do I speak English?
Yeah, mix it.
Okay. Hi, you okay? No.
This is bonus. How does that feel as a student? You feel better, don't you? You belong. Didn't you get warm? That warm feeling when a tutor looks at you and says, "Hello, thanks for coming. Yeah, thanks for coming all the way to Oldham." Okay.
Maybe get some of the Alright. How can I help you today?
Are you asking?
Yeah.
I'm asking people on the student though.
It's okay. It's long in the day. It's a long day. It's a long day. It's a long day. It's a long day. It's okay. It's okay. Okay, so group, help them out. They're doing brilliantly. They're under pressure here. To the other, they just came here to listen to the talk, but they're actually running this talk now. What phrase would you use to help Lareb to help Khulud? What would Lareb say to Khulud at the beginning to help this situation?
She could explain that she's going to speak in one language and then go on to explain it in English.
Brilliant. So do you want to do that, Lareb?
Yeah.
You speak to Khulud and explain the situation.
Should I say that Sanya doesn't know?
Yeah.
Basically, Sanya does not know English that well, so I'm going to speak in 2 different languages. I'm going to speak in Urdu separately with her, and then I'll translate back to you in English. That's okay with you?
Yeah, that's fine.
Yeah, it's okay.
Yeah, brilliant. Well done. That's happy with that. Where do you take it next with Lareb and Khulud? Anything else you want to say?
I guess you could just continue the clarification as in like anything she says to me, she could like explain to the student.
Brilliant. So there's that clarification thing. Okay? So do it again, but this time include your student. Let's see you in action there. You can talk about the weather, because no one here understands, apart from maybe 2 or 3 people. No one at the front. Okay, go for it.
Yeah. Did you feel cold this morning?
Yeah.
This is so cozy, this conversation, isn't it? We're all talking about the weather. Forget about the reason for attendance. Happy days. Okay, brilliant. Okay, so you're doing that. You're summarising it. What else can they do now? What other things from what you said before? Let's recap. Anything else?
Would asking for students' input, please?
Yes. Okay, do you want to do that then? Lareb, speak to Khulud. Yeah. Remind me not to work with medical students.
Anything you want to ask me specifically?
Could you ask the patient how she feels about today in general?
She thinks she's not good.
Okay, so we'll come to the end of the conversation. Now, one of you guys mentioned about to wrap up. So how are you going to wrap up? So, Sanya, thanks for your time. Yeah. Okay, so this is the afters. Okay, so Lareb, you're with Khulud afterwards, after the consultation. What we're going to say? What are you going to say to them?
Apologize, first of all. Maybe I didn't pay attention too much.
Okay.
Maybe not.
You could just find out.
Oh yeah. Just,
So you summarised it. The weather was foggy.
Yeah.
That's the conversation, was it?
Yeah.
Okay, so you said the weather is foggy.
Yeah.
Now what are you going to say next? Group help. Yes, all the nice woolly stuff from CSLC teaching. We taught you it first. Okay, the bottom line is you should have an opportunity to debrief because it is such a difficult thing. Because already the barrier has been set, hasn't it? The barrier has been set is two people understand the same language, the third person doesn't. If you're ever, have you seen that yourselves in clinical practice? How many of you have seen that in clinical practice? So you know what's going on here, yeah? And the worst thing in the world is if you're that third person who is not in with the in crowd, the Urdu crowd, yeah? If you're not in with the Urdu crowd, then you feel out of place, okay? So the answer is to include them in the consultation, but then to have good debrief afterwards, okay? The opportunity afterwards. Does that work out? Okay, brilliant. Thanks for your time. Okay, so any questions about that? Mind your language. So this is what we've been traipsing around for the last 5 years. I have ambition to go to Bora Bora next with my work. It hasn't worked out.
What if the patient is the one who doesn't speak language the doctor does, so there's a translator?
Oh, good. Well, not good. Then you've got the interpreter. Have you been... I have to be careful here on record because my dad is an interpreter. But have you been to consultations where there's a massive conversation between interpreter and patient, and the answer from the interpreter is yes? And you're wondering, that language? Is that how is it like an elaborate from Lord of the Rings, like the way they're taught, you know, the Ents, the trees, they talk to each other. It takes like 6 hours for the Ents to talk to each other. Does it take that long in that language to say yes? So you think things have been missed out, you know, like the rest of the story. So interpreting is even harder. So we don't do a workshop on that, but you have to engage the interpreter in the consultation as well.
I had an even worse experience when there was a phone dial-up interpreter.
Oh
So
yeah.
we couldn't even understand half what they were saying because the phone line was really bad.
Right.
And they just we didn't have a clue. And we had to sort of wait ages to kind of get a phone interpreter on because they hadn't said earlier that they couldn't speak English or anything like that.
The phone interpreter couldn't speak English.
No, sorry, the patient.
All right.
They weren't aware that the patient couldn't speak English.
Yeah.
So they just came in and they were like, and they just managed to find out which language they spoke, and then they had to ring up this interpreting thing, and that was just a bit of a nightmare. I think it took about an hour when it should have taken 15 minutes.
What's the other barrier with phone interpreters? What's the other barrier? What's the other big barrier there in terms of languages?
Well, you're not picking up non-verbal communication.
Yeah, that's an important one because what I say to students who are in a conversation where it's not in English is look at the manners, the body language. You can pick up a lot there. You'd be surprised at how much you understand basically by the body language as well. So look at that as well. In a telephone interpreter thing, it's all gone, isn't it? And it's difficult as well. Okay. Anything else? Happy with that? Okay, so what I've had to do is learn Bengali properly. Because when I was growing up, I hardly spoke the word of it, and I thought, there's no point in learning this language. Who am I going to speak to? Then I end up in Levenshulme. And over the last 2 years, there's been an influx of the ultimate people, the Italian Bengalis. Yeah? The Italian Bengalis have come in. I wanted them to say arrivederci in Bengali accent, but they haven't done that yet. So there's loads of them coming in, and suddenly I've had to step up. And it's been brilliant, because now I can actually understand my relatives. What my uncle is saying to me, because I've been to Bangladesh before, where my uncle spoke to me, and I didn't have a clue, and I think I said to him, he asked me a question, I think he was asking about, can you pass me the salt? And I think I just said to him, yes. And I just stood there like that, and things like that. And I've also, in conversation with my relatives, they asked me, who do I live with? The Bengali word is bondhu. Okay, that means friend. I said the word bandor, which means monkeys. And my auntie got really worried. She said, what kind of a country is this? Your housemates are the monkeys. Or have you no friends and you're a bit of a loser? So it can go wrong. It can go wrong. So I had to learn proper Bengali in order to communicate with my colleagues, okay? I've also had to learn Urdu, a bit of it. So I understood what you guys were talking about. Yeah, I was pretended that. Over the last 7 years, I've had to pick it up because I learned the hard way. When I went to Bradford Royal Infirmary, when I was working as a house officer, in the middle of the night, I thought, I'm so cool, I've learned a phrase in Bengali, I'm going to use it. So I was meant to say, Aapka dard kahan hai? Which means, where is your pain? You know what I said? Aapka dard kaun hai? That means, what does that mean? Who is your pain? So rather than talk about the tummy, we have a philosophical discussion about the people who are causing pain in their life. So you have to be careful that you actually are competent in the language that you speak. So my patients still laugh at me because I always get it wrong, okay? But I know chakkar. Chakkar means the room spinning, and you'll go far if you understand that word. Okay, so what has gone well is, what do you think is good about me being able to speak that language?
You can get through to people who don't speak English.
You can get through to people who don't speak English. What else?
They feel more comfortable with you.
They can be too comfortable with you. I have long surgeries. I have patients that come to the desk, yeah? They don't know I'm part-time and they come in, they don't speak any English. Then what they do? They come to the desk and go, hack! That's all they do. Because they want to see me. I advise them to come in on Thursday when I'm at uni. Anything else? I can help them because that third person is out. I'm not knocking interpreters. Like I said, my dad is an interpreter. My father-in-law is an interpreter. We love interpreters. But interpreters are a barrier. They do not give the correct information. If you can understand a language, then you can actually go direct with them. I tried some Spanish the other day because I did GCSE, and again, I get a bit arrogant when someone with another language comes in. I go, yeah, I know, I'm the man. So you know the only word that came to me? Adios. And I was saying, the guy cracked up. He just like, this guy, I would make out to him, like, I know Spanish, yeah, this bueno, and all this sort of thing. And no words came to me. So, my advice to you guys is, if you, a lot of you guys know other languages, utilize the language, but be competent in that language. Don't utilize languages that you vaguely know about, okay? You must make that an opportunity for you as well, okay? So, it's been good, it's been bad, it's been a great experience. Thank you.
Maybe open questions towards the end.
I have to leave, sorry.
Okay.
Because my wife's going to kill me.
Okay, can you take a few questions?
Last time I can take a few questions. The last time she phoned me in the middle of a GP SOC talk saying, where are you? So I'm somewhere else if anyone asks. Okay. So, yep.
Do you know the different dialects?
Okay.
Because obviously it changes the meanings around completely sometimes. Like how to deal with that, or that is actually the experience.
Yeah, that's difficult because I speak a dialect of Bengali called Sylheti. That's in the northeast of Bangladesh. But we call the other one Shuddha, which is like the proper Bengali. And the dialect is difficult. So a lot of the time I just have to say, I don't understand a word of what you're saying in Bengali. So yeah, you have to understand that. You will make mistakes. Yeah. What I would say to you is never put yourself in an awkward position. What you could find yourself is, you could be in a practice where a patient comes in who speaks, let's say, Hindi or another language, and you speak that same language, and the GP might use you as cheap labour. I can't be bothered to get an interpreter, okay? Has anyone had that situation? You have. What happened?
It didn't happen in GP, it happened here in the hospital. We just had like doctors basically using, in the pediatric emergency, like just to save time, using medical students who could speak a couple of languages, just going around as interpreters and stuff. It just meant we couldn't really take histories and we weren't fulfilling the purpose.
Exactly.
Why we do that.
Exactly. So I would say, don't be used as a term of service just because you can speak the language, okay? Don't go around saying, I don't speak anything. Not looking at anyone in particular. But don't be forced into a situation you're uncomfortable with. You're not there. You're there for learning. You're not there to be providing service, okay? So if you don't feel comfortable with it, don't do it. My student at the moment, he loves speaking languages, though. I have to stop him because he loves speaking the language that he speaks, and he does the history in that language, and he interprets for his colleague, which is brilliant. But don't feel pressurized to do that, because that's not your remit, okay? And like you were saying, you're training to do consultations in English, aren't you? We haven't got to higher level training, although I would love to do an OSCE in that. You would hate me for that. An OSCE with an interpreter. I would love to have an OSCE with an interpreter. Now you think this guy is mad. So you don't have to do that. You have to be competent in your English language. Forget the rest. The rest is a bonus. Okay? If you ever have any problems with a GP, let the community-based medical education team know. We can help you if you're having difficulties with that. Okay.
Do you think knowing other languages sort of opens more doors for you in terms of career opportunities and not just kind of convenience when got patients?
Yeah, I'm really famous now because I'm on a CCG video speaking Bengali. But the problem is my Bengali is actually called Benglish because half of it's in English, and people who don't even speak Bengali understand exactly what I'm saying. So, but that's as much. But in terms of facilitation, yes, it does, because it means that you can become a major player in that community. Because if the language barrier is gone, you can understand the health inequalities of that practice. So what I'm involved in, Omar is as well, we have a charity called ASDOC, which is an organisation. We go to local mosques, community centres, and we actually deliver in the language of that population health awareness activities. So that is cool. Because we've got the language there, we can actually deliver what is actually the problem. And the best one was hepatitis C we did. We've been working with Public Health England, Greater Manchester Hepatitis C strategy, and we did it in Urdu. And we challenged their people on their stereotypes of people with hepatitis C. People thought you get hepatitis C by shaking hands or sharing food. Hands up if you thought that's how you spread hepatitis C. Thank God for that. So you guys are all right. We had to explain to them about blood transmission and other things, and it's not a stigmatizing condition. We did it in their language, they understood. I am now very unpopular amongst the barbers of the Punjab, because every second sentence I said, avoid the razor, avoid the contaminated razor, because that is one of the commonest reasons why people from the Punjab get hepatitis C. But because we could convey that information, it meant that we had that opportunity to deliver public health work. So if there's a language you speak, find a community and deliver workshops there. It'd be cool. Anything else? Thank you.
Thank you.
Okay, thank you.
So next up we have, yeah.
I should say Dr. Meyer's on his way. He'll be in about 3 minutes.
All right. So,
Just ask
yeah. So we have Dr. Anisa Jafar. Unfortunately, she couldn't make it today. She recently just had a baby, so she's taking care of them right now. And she's an ST4 in emergency medicine, and she also did European studies in Manchester. She did French, so she's gonna be talking about her experiences in specific relating to European studies. So yeah, it's about 20 minutes. So let me know if the audio is okay.
Okay, so my name is Anisa Jafar and I am an ST4 in emergency medicine. I apologise for not being there in person. At the moment, right this second, I think our baby is, did we decide 17 days old, I think. So unfortunately, I couldn't guarantee I'd be able to make it. Basically, what I'm going to talk to you today is about languages in medicine and my experiences of how I've used languages, my experience of the European option, which a lot of you will be aware of, or not aware of, and if you're not, I'll explain a little bit about that as well. And a little bit about my journey. I will try and keep this to sort of 15-20 minutes, as the brief said. And there may or may not be slides associated with this, depending on how the technology worked out. And if there is, they won't be that exciting. If there isn't, they weren't that exciting, so don't worry, you've not missed out on anything. So, why was I interested in languages? Obviously, medicine, languages, they seem completely sort of separate in terms of faculties, in terms of ideas, in terms of interests. I had quite an aptitude for languages in high school and college. I enjoyed them, and to be honest, if I was to list my subject interests in terms of A-levels, my first most favourite subject was English literature, second was French, followed by all the rest, the maths and the biologies and the chemistry. So something I've always been interested in, and I think, as some of you will know, or all of you will know, medicine isn't just about medicine. You do have to sort of keep your own interests up, and they do sometimes fit quite nicely in with your chosen career. My personal background as well, my dad is from Pakistan. He speaks Pashto, he speaks Urdu. My mum speaks English only, and I think I was a little bit I felt a little bit under-equipped for being from a mixed race background. I couldn't speak anything other than English. So I made a lot of effort with my French at school, just as a kind of curveball, because I hadn't picked up much Pashto or Urdu at home. So there was kind of a little bit of me driving to learn a language because I hadn't taken what people expect from a sort of a mixed race child background. Languages are a skill. In some ways, although it's wonderful to be fantastic at maths, to be fantastic at biology, chemistry, all those subjects, they don't always give you, they give you transferable skills, they don't give you an actual skill that you could put on your CV, for example, something that you can carry on and build. Languages, you know, you learn French, you learn Arabic, you learn Chinese, whatever Chinese, it's not even a language, sorry. I'm showing my ignorance here. You learn Cantonese, you learn Mandarin. Forgive me, baby brain, we'll just blame it all on baby brain. You know, you pick something up and you can keep building on it, and it's something you can take with you for the rest of your life, a bit like, you know, learning to play an instrument. The other side of things, learning languages in medicine does open doors. It means that, for example, if you're ever interested in working for the World Health Organization, obviously this is the Global Health Society, so there are many of you who'll be interested. I'm not sure if it's an absolute prerequisite, but I think it may well be that you have to be able to work in French as well as in English. So for that is kind of something where a door would not be open to you if you hadn't picked up another language. Similarly, if you wanted to work in another country where English wasn't widely spoken, the doors wouldn't be open in the same way as if you had the language skills for that particular country. And for me personally, I think it has opened doors in subtle ways, which I'll talk about a little bit later. With regards to my choice of doing the European option in medical school, it was something I kind of, when I'd applied to Manchester, I thought it was a fantastic opportunity, and at the time it was actually free as well. I don't think it's free for you guys anymore. I don't know how expensive it is, but nothing's free anymore, from what I can gather, anywhere in the world. It was nice to be part of a small group, because obviously medical school, I don't know what it's like for you guys now, but you know, at the most our year groups are up to 400, 450, and sometimes you can feel like, you know, very small fish in a very big pool, a little bit lost sometimes, a little bit like you don't have groups that you can stick together with because you're always changing groups and moving around. And with what was my French group, the European option, we stayed together throughout medical school from sort of year one all the way to sort of the end. And the friendships that we built up and the experiences we had, you know, really bond us together. Now, it's not the only reason to do it, but it is certainly something that makes the extra work easy to deal with, because don't forget, obviously, you've got your medical school work to do, but then you've got these extra sort of language exams and language tuition, etc. But the social side of it was kind of very, very strengthening for all of us. It obviously gives you an opportunity to travel during medical school life if you do pick up this European option, which again is the theme of why we're having this presentation at this particular time, while you're considering your options as to whether to join the European option or not. Forgive me if this is entirely wrong, but this is what I understand it to be at this particular time. You know, you're at whether they call them SSMs, SSCs now, the special student selected components, the bits where you get to choose what you want to do. They keep changing the names of them all the time. But when I was at medical school, we were allowed to do one of those abroad. We managed to lobby the medical school to make it 2. I believe in recent years it's dropped back to 1 again. I don't know whether it's changed again back to 2, but just to let you know, we managed to make them agree to 2. So whether you have the capacity to be able to lobby them to do the same, I'll leave it up to you. But it meant that I spent one of my SSMs or SSC in 3rd year in the south of France. It was 35 degrees. Everyone else was in Manchester. I was there for a month. Now, forget the language side of things. It was just a wonderful opportunity to be out of the country in a sunny place doing something legitimate to do with medicine. But it really just made things feel exciting, feel different, and allowed me to pick up lots of different skills whilst doing something that I had to do as part of my medical school anyway. And then the next time I did another SSC in Paris for 3 weeks. So again, can't really complain about that. And the other thing for me really is when there's an opportunity in front of you, now obviously the financial side, you've got to consider whether you can afford to be learning languages alongside medicine. Why not? When there's something given as an opportunity to you to pick up and to run with, assuming you're not a medical student who also holds down a part-time job, is bringing up 4 children and running a house, which some of you will be, and adding an extra string to your bow is probably the last thing you want to do. Full respect to that as a new mother. However, if you have got the time and space in your life to do it, why not? Opportunities don't come all the time, and I think if you can, it's something that's worth doing. Now, in terms of language, let me go back on the slides. Language influence on career. So how has it affected my career? When I was going through medical school, it gave me a confidence in my own ability as we kind of went through. I mean, obviously, you do all the medical school stuff, you do all the medical school exams. Sometimes the exam formats can feel a little bit hit and miss, and you can feel like, oh, I did lots of, it depended again on the format, the way it used to be for us. We used to do the progress test. Do you guys still do the progress test? I've got nods from my my film crew. So that's an exam that is designed the way it is for lots of reasons, but it can sometimes make you feel like you put all this work in, and sometimes your results don't always match up to the work that you've done. Obviously the other exams are a little bit different, so you can feel sometimes like you're cycling really, really, really hard, and sometimes the output isn't what you expect. Whereas the language, when you're learning it, it's very, very progressive, and you do see that progression. It's quite nice to have something going on alongside medicine that allows you to feel like that, allows you to feel those little bits of achievement. As you learn that new vocabulary, you learn the new grammar, you become more able to have conversations with people. So that's one really, really nice side of it. It does build your confidence and allows you to kind of sidestep medical school in some respects. It makes you more adaptable. I mean, I think about the SSMs and SSCs that I did over in France, because French was my chosen language, and it's hard enough learning about the kidney in English. So find yourself in the middle of a French hospital and people asking you to explain what's going on in this patient in French. Something to do with the kidney, and you're thinking, my goodness, I never even understood renal physiology as it was, and now I've got to do it in French. So you put yourself under quite a lot of pressure, and it can be quite stressful. But then when you think of it later on, when you become a house officer, sorry, I can't say house officer anymore, that's banned, isn't it? F1, sorry, Foundation 1. Well, that's probably have changed by the time you've all graduated anyway. So anyway, when you finish medical school and you become a doctor, you've already been in a very stressful situation, and actually it's a lot easier to deal with things in English than it is in a foreign language. So this is a really, really good way of building your own confidence and your own adaptability. You learn to use body language and be more perceptive to body language, because when you're struggling to kind of match up medical French or medical German, whatever, with the English that you've got in your own mind, you have to learn to read cues a lot better from your patients. I think this helps in terms of sort of picking up emotional cues. When you're not just relying on language, you really do have to focus again on that body language side of things. It makes you more resourceful. You have to ask for help. If you have been, so for example, if you do, again, complete the European option, which is what I'm kind of referring to here, and you spend time in your final year, which for me it was 4 months, I think. It may have changed now, things do change. While you're there, it's a long period of time to be away from home, it's a long time to be away from the people that you know, the things that you know. You have to be resourceful, you have to learn who the people are who are going to help you around. You've got to learn to identify the characters who are actually going to be quite supportive of this foreign student, because you are the foreign student. And it teaches you to recognise that in other people later on when you're in other situations in medicine, and you can see the kinds of people who are going to be helpful to you, because you had to learn it in that situation. And it certainly makes you more appreciative of people who've come over to the UK either to study or to actually work in a medical environment, and hopefully makes you more empathetic and supportive of colleagues who are learning medicine in not their mother tongue, because it really, really is an extra challenge. And I think anybody around here in front of me who has come from elsewhere, you know, English perhaps not amazing when you arrived, to pick up English and medical English is, you know, something you should all be very, very proud of. And I think something that, you know, sort of native UK students really need to appreciate in their colleagues and support. So it gave me those kind of transferable skills. It also, I think, helped me get my academic foundation job in London. And I say that because the job itself I wanted to do because it had an element of public health. It had a 4-month public health job. And one of the things I wrote down was my interest in public health and global public health. Again, looking at the WHO connection and how I'd be able to work in a francophone environment because of my French. And it was a skill that I was able to express and explain, and again, all these adaptability adaptability qualities that I'd picked up, I was able to kind of expose on that application form. Again, things change, and the applications for academic jobs will have changed by the time you come to apply for them. But it was certainly something that stood me out, I think, from my colleagues and allowed me to get that job. It also influenced my understanding of medicine in other cultures, in other countries, and probably helped prompt me to choose to do the diploma in tropical medicine in between my foundation 2 year and my sort of specialty trainee post. So it was giving me a flavour of how medicine is practiced differently in different countries. Now, France isn't, very different economically from the UK. However, medicine is practiced very, very differently over there. And you see the roles of the doctors being very different from the roles of the doctors here in different settings. The roles of the nurses very, very different from the role of the nurses in the UK. And it just makes you start to think outside the box of UK medicine. And as I say, prompted my interest probably in global health even more than it was already established. Again, then we moved on to the academic clinical fellowship that I achieved for my specialty training. So that basically meant that I was able to do some research alongside my clinical training for the past few years. A competitive post, again, the fact that I'd been able to practice in a francophone environment to demonstrate that I have the wherewithal to do that, to continue that. And also at the time I'd started to pick up another language, which was partly influenced by having met my husband, partly influenced by that, partly by my own interests and my own sort of cultural and religious background. I started to learn a little bit of Arabic, and it actually was it's no coincidence that, again, that it's one of the official UN languages. So, picking up languages that are recognised as being extremely useful globally, again, just sort of stands you in good stead for being an attractive candidate to do things that are outside the box, because you've demonstrated that you can do your normal thing and also don't do things on top of that. So again, I don't think it was a coincidence that played a strong part in my application when I actually wrote it all down. And then obviously my work more recently with the Humanitarian Conflict Response Institute, which you'll all probably be aware of, the HCRI. It's something that has attracted me to working with the HCRI and attracted the HCRI to sort of working with me, because it means that if in the future, which I haven't done so far, some of the work that I'm interested in, medical record keeping in sudden onset disasters, pardon the phone ringing in the background, it will go off in a moment. Domestic bliss. So yeah, some of the work I'm interested in is sort of medical record keeping in disaster settings. And Haiti was a very specific setting where an earthquake occurred, and we learned lots about how disasters are managed. And some of the work I am interested in doing may take me over to Haiti. Being able to speak French will make a huge difference over there. So I'm able to actively use my language skills to further my interests in my own career. And forget that, when French-speaking patients come in to the A&E department, it's really nice to be able to say, yeah, I can speak to them, that's fine, yeah, send me in. A bit rusty, and it's not perfect anymore because I don't get to practice it all the time. But it certainly gets you by, and also gives the face of relief for patients who are really struggling to manage to express themselves in English, even if it's just a couple of words. That kind of support that they feel that somebody might be able to understand them a little bit better is incredible. And any of you who've been able to speak to patients in their own language will understand that. They just suddenly feel at home and you get more from them. Again, it may be that their English is actually better than your French, your Spanish or your Cantonese or whatever, but it's that just familiarity, and they feel as though you've connected with them, and you can't underestimate that in any way. So, there we go. So just a couple of pictures now, if the slides are there. So this is just to tempt you all to do the European option, to go and spend those 4 weeks in the south of France with 35-degree heat. So if the picture's up here, if it's not, I'll describe it to you. It just basically shows you a little place called Sète, which is near Montpellier in the south of France. The top picture, if you can see it, just is an overview of the place, and you can see that the sea is very close by, very, very beautiful. Quite nice to spend sort of your evenings by the sea. one of the bottom pictures again, it's just a little bit of a scene showing the canal running through. So you're gonna have to close your eyes and imagine if you can't see the picture at the time. It's very pretty. There's kind of nice light on the water, and there's canal boats, and yeah, it's all very French, lovely. And then the final picture is a group of guys that I met when I was out there, and we're learning to play pétanque, which is like boules. I'm sure some of you have heard of it. So basically, what you would see on the picture is a floor, some balls, and some people. That's just to show you kind of integrating with local culture. So the next set of pictures is, well, if you can see it, you'll know what it is. It's the Eiffel Tower. Beautiful sunrise. I think that was early in the morning. I took that when I was off to the hospital. This is for my second SSC. Then there's a picture of me in my disposable green scrubs when I was doing my haematology oncology placement. I look a lot younger than I look now. I'm probably a lot less tired as well. And then down below again, just a picture of me in front of the Louvre. I just wanted to show pictures, basically. Pictures of me looking better than I do now, so that you don't think I always look like this. It's the baby. And then moving on to the 4 months that I spent in France. Again, a picture of Pitié-Salpêtrière, which is a very famous hospital in Paris. So I spent the 4 months there. Very, very, very well known, very renowned. Lots of famous people. Babinski, as you probably know. He studied there, and many other people. I think was Charcot there as well, I think. Anyway, all of these people whose signs you've heard of, a lot of them came out of Pitié-Salpêtrière. A picture of the tube, just because it's a nice picture. And actually, I think that got into a magazine somewhere for the British Council somewhere, so that's why I put that in there, because it's in a magazine somewhere. So there we go. So the copyright is mine if ever you see that. And then a picture of the group of people that I made friends with whilst I was out there. Again, fellow medical students at the same level, and they were all very supportive. I think that's a picture of a savoury crepe in the corner. I don't know why I put that in. I think it's because I enjoyed it, so it's there anyway, if you can see it. So really to summarise, languages in medicine, it can improve your communication in general, obviously, because you can communicate in another language. It makes you more adept to other people's body language, emotional signs and symptoms that they're kind of giving off that they're not perhaps expressing verbally. If you work in a multicultural setting, obviously centre of Manchester, having another language is invaluable. Even if you learn something really obscure, you will find that there'll be somebody that turns up to particularly the MRI A&E department speaking that language. Helps you understand other cultures as you work in other cultures, and helps you to connect with patients when they come in and you can speak a few words of their own language. It also makes you do a bit of mental gymnastics as well, because it opens up the other side of the brain. I cannot express enough how amazing it can feel to access the language side of your brain if you're able to. And I know some people have a stronger aptitude for it than others, but even if you haven't got the strongest aptitude, there are things that you can learn, and it is, as I say, I can't advocate it enough. And it adds an extra interest when things are getting a bit boring, learning about the bones in the forearm, just to be able to justify going out to watch a French film, or put a beret on and go meet up with the French group, or I don't know, if you were doing the Spanish option, maybe you'd wear a matador hat, I don't know. I'm not quite sure what's typical Spanish dress. Maybe you all go out in flamenco dresses, something like that. But it really has been a great experience for me, and I do try and keep up with it as much as possible. As I say, I'm trying to improve my Arabic at the moment, just to add another string to my bow, and from a family point of view, my husband speaks fluent Arabic. Well, hopefully our 17-day-old baby will be able to make him bilingual in a way that I was never bilingual. So there's a lot of family issues, you can see. I'm joking. So thank you very much for listening. I'm sorry I can't answer questions directly. There may be an amazing video link that I can answer questions on, but if you have got any questions, I'm sure somebody can pass on my email address. So I'd any of you that are interested, pick it up. You can always drop it. You can always turn around and say, look, this isn't for me. But if you're considering it, I really would consider running with it, even if it's not the European option, even if it's just spending time in the International Society, brushing up on that bit of Slovakian that you learn once. Keep it going, because you never know when it's going to come in useful. I think that's all I've got to say. I think we've done that in one take. I don't think we could deal with listening to it in another take, so thank you very much.
Lovely place.
fantastic place in North Wales, and he was from Wrexham of all places, and I got on with him, and then we travelled a little bit together to Alexandria, and then he came to visit me where I lived then, which was Hamburg, actually. That's where I'm from, and we still got on, and then I thought I should try that, and then I asked him whether there's a hospital where you live, and at that time I didn't even know that Wales was totally different from England, I have to say, to my embarrassment, but I did. So and then I thought surgery might be the best because you don't have to talk to people so much. So I wanted a little bit, but not really full. So I applied there, and then I got a positive answer, and I didn't need accommodation because I could stay with my friend. And so I went there very nervous, and there was a Lister ward if you ever come to Wrexham. I came in there, and then it was the day case surgical ward. And do you remember, there's a lot of day cases you can do. Yeah? There's one particular day case in surgery that has to do with family planning, and it's done with young men. And I was sitting there and being very nervous. Then the nurse came and asked my name and gave me a little pot. Yeah? And you do that 3 times. And I didn't know what it was. She thought I was coming for a vasectomy. That's actually true. And I said, no, I'm the new medical student. Oh, excuse me, took it back. And then I was introduced to this team in Wrexham. I didn't know that everybody is called Edwards, Jones, and Griffiths. I thought it was amazing. Everybody was called that. And then the surgeon, a guy called Mr. Pye, who is to this day one of my heroes. I think I've never met anybody as gentle and as good clinically. And I saw everything there. At first, I had no idea about some of the stuff they were telling me. Took a history. I said that before in my introduction, didn't I? When a huge guy was investigated for dysphagia. And the question obviously was, did you lose any weight? And I asked him whether he lost any weight, and he said, yes, 7 stone. I had no idea how much that was, 7 stone. Being a kilogram person, I didn't know anything. And then the surgeon asked, did he lose any weight? And he was a big guy. And I said, yes, he did, 7 stone. Wow, that was a lot, and I didn't even know. So that was a bit of a language thing that I didn't know. And then I had many more of these little events where I just didn't know what they were saying. And so I did that for a bit, and I really liked it. And then there was personal things developing. You know, Wrexham can be a really romantic place, and so I did part of my final year back in the UK for that kind of romantic reasons, and I did it in London at the Middlesex Hospital, and then I did a back surgery back in Wrexham at the same place. And I would always go to Wrexham, but I wouldn't really go to the Middlesex. And that's what I keep telling people. It's not that you go to a huge, fantastic place. It's where you go and people make room for you, because that counts. That's where you learn. If you are there between many others, it's not so exciting. You need to really get in there, and you have to go alone, because otherwise you're always kind of protected by your mate things. And then I applied for a job here doing neonates in Salford. And it took me a while to understand what it means to have your knickers in a twist, especially if it's a baby, because they wear nappies and not knickers. And there were things like that quite a lot. And I did work at the Children's Hospital, because I'm a pediatrician, I'm a pediatric oncologist. And then there was I did surgery. That means clerking in patients, loads of patients for little surgical procedures. Very, 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 very boring. And I always did my proper history, and then you ask what the mother does. I asked, what do you do? I work in a race, she said. What do you do? Where race? That's Wigan. That's my trying to do a Wigan accent. And finally, she works in a warehouse, but it took me a long time to find that out. And now I can discriminate between Bolton, Blackburn, and Wigan, how these people talk, but I can't really do it myself. But it's something very special when you actually can after a while, I'm very proud of that I can say you are from Wigan, but you are not. Don't want. And I've been to, have you all been to Wigan on a Saturday night? It's quite an amazing place. And that's how I got here. Since then, I did, I became did lots of oncology. And in the end, I started writing my own English books. I wrote the chapter about pediatric oncology in Forfar and O'Neill. I don't know whether you read that book, but it's a pediatric textbook. And I and my colleague, we did that chapter about cancer together. So I thought from admiring somebody, from having the book to writing it, it's quite a journey. And I think, I think I was very lucky with all these things. And when you do this European studies, then it's much more formalized now, and it's not so easy to go to places, and it needs much more organization. But we try to do that for you in the European studies, and because of my CV, they asked me to lead on that, and that's what we try to organize for you in the places we work with. And now I have to go to places where I don't speak the language. When I go to Madrid, no idea what they say, or to France, I don't know either. And I speak with the guy, and you normally have to have some dinner with them, and they have wine at 10 o'clock in the morning. But I think they only give you that because they think you expect it. And then you meet very interesting people. The guy who does it in Paris, my counterpart there, who became a really good friend over these kind of collaboration with his students and ours. And he's an interesting character. He looks like Tom Cruise, and he worked a lot in the Senegal, and now he's into big way into artificial hearts and resuscitation and stuff, doing something totally different from me. But you meet interesting people in other places, and it's I think it's only increasing what you want to do. My now mother of my children, she worked for Médecins Sans Frontières in Sri Lanka, and she spoke English and hands and feet with the patients, but she needed, or she speaks a bit of French and a bit of Spanish. She needed that for the other doctors, for the other colleagues there. So it's good to have it, even if you're not working in that particular country. And it's just a very interesting thing to do when you start to understand what people think and what they say. And I'm very much into linguistics anyway. And what I do now, I translate poetry, which is actually very difficult. And to get the gist of the language is something I quite enjoy. And I think you really have got a different level of access to your own language if you see it from another one. So that was more or less what I had on my slides. If you have got anything you want to ask me, then do so.
So, what was your journey to setting up the European Studies program in Manchester?
My journey?
Yeah.
Well, I had a CIUK fellowship and was just working purely on molecular biology and genetics of leukemia. And they paid me via the university, and I did clinical work at the Children's Hospital. And then this finished. And then the university wanted something from me because they continued to pay me. And first I did something about the curriculum development, and that then all kind of didn't, that was very boring. And then they asked me whether I would do this, being a deputy of Professor Nices, who is also originally from Germany, but he worked in Switzerland and France and somewhere else, and he's now in Luxembourg, so he kind of moves on. And when he went, he asked me to take this on, or I was asked to take this on. That was my journey. I knew it exists, because I gave these master classes. So I talk about my stuff in German because I speak the language, which is basically inherited cancer syndromes in children. That's what I do, and I can do that in German as well. So I do that for the master classes. I don't do that anymore because I spend enough time with European studies, but I could do. And and that's we try to make this kind of a bit more streamlined, because in the there's no other medical school who has got the European studies in the UK, and there's no other medical school who has got these kind of integrated language tuition and such a good collaboration with places. They very often have collaborations, and much more often on an ad hoc basis, but not in a way that is integrated into the course like Manchester has. And this was just recently reviewed because European studies students are very unhappy for some reason in the student survey, because they are kind of in a different box. So we can, when they are surveyed, they are separate. And they came out much more unhappy than the rest. And it was very difficult to find out why that was. And one of the reasons is obviously they go to Paris and have Tom Cruise. So we can't compete with that. At least not, but because they see more. Yeah? I think there's a place in Berlin when you are into neurology, they start at 7:30 and finish at 8:30. And you see everything there. I mean, it's amazing what you learn. It's equivalent to, it's absolutely brilliant. And if you want that, then everything you do here in neurology doesn't kind of match up. It's the other way around as well. Sometimes there's sort of party and good weather, so people judge Manchester slightly different, which is, I think, a bit unfair, because we make you go to the other places. And then there's also some expectations that this is a kind of parallel medical course in another language, but that's just not possible. For we can't provide this. Berlin does that. Berlin gives a whole course in English, but people need that because you are in an incredible advantage by speaking the language that you need for any scientific or international career. For people from Portugal and from Italy, it's really difficult. And even if you have the best scientific results, if you talk like the evil ones in the American films, it just doesn't go down. So you need that, or they need that. And so we could fill our course with people who want to come here very easy. But we don't, because we have these partners with whom we work, and that works well. Oh,
what do you think about in terms of the languages, say choose Arabic, for example?
I think it would be great to have something with Arabic, to have something with Portuguese, because of Brazil and Portugal, to have something with Italy. The thing is that if we want to do this, we need to have a kind of GMC approved partner. Yeah? When you go there, when you go to Berlin or Madrid or France or Paris, the GMC accepts that. Yeah? They say, okay, that is, we would have somebody from Berlin working in our place as a doctor, and we can qualify this. But it's much more difficult in places that speak Arabic, and the exchangeability, which is also, it's a paper exercise to some extent, because it's all European law, and it's all the European Union and all that. So that would be much more difficult to set up with an Arabic-speaking country. And there are certain issues which it would be much more difficult to find somewhere that gives an equivalent training, not only in the language, but also in medicine for the placements. I don't think that anybody would be against you to go there. There was a young lady who wanted to go to Yemen, and I think she was discouraged because that's not the right place to go at the moment, I think. But there's nobody who would stop you. But in terms of teaching this and promoting this, that's much more difficult, because there are people who have a very high level because they speak it at home anyway. But then it would be very difficult to get master classes and all the other things. And Italian, we were approached. There's nobody who speaks Italian enough to start somewhere. There might be one or two, but for those very few people, we can't provide this. Portuguese, it's the same. So I think for the moment, we stick with this. That's why it's called European Studies, by the way, because there's not Arabic as a first language in any European country. Although it would be very, very helpful. But I think Arabic would be helpful here, and many other languages, because there are people who don't speak very well. Chinese is another one, that is, or Korean, and lots of the Indian languages. But again, we can't entertain an exchange program as easy, and as GMC. Any other questions I could help you with? No.
I think that's it.
Thank you very much.
Thank you.